Um, the next speaker on podium is Dr. Ganapathy, President, Apollo Telemedicine Networking Foundation.
Good morning, everybody. At the outset, I would like to thank the organizers for inviting me here. In the next 600 seconds, I hope to convince every one of you in this auditorium that digital empowerment is the only way in which we can provide quality, affordable, accessible healthcare to everyone, every time, anywhere. I necessarily have to show some photographs. That's the only way I can convince you that what I'm talking is not just theory, but practice. Since there are so many bright people here, can we please switch off the lights, madam? Excuse me. Just switch off some of these lights. Thank you. The others can go to sleep also if they like. Little more. This was a paper which I published 2 years ago, and this states the horrible facts. 938 million Indians live in places where there's not a single neurologist or a neurosurgeon. I'm a neurosurgeon by training. You can extend this, substitute this with oncologists, rheumatologists, even general medicine, physicians, ENT surgeons, whatever you want. Not in the lifetime of my great-great-grandchildren will there be enough brick-and-mortar hospitals. We hold the world's record in having the minimum number of doctors, nurses, hospitals, healthcare providers, etc., etc. At the same time, India is a paradox. TRAI announced a few weeks ago that we have reached the 1 billion mark. Yesterday, Reliance announced that for 153 rupees a month, they are going to give unlimited data. This is the power of information and communication technology in this country. Why can't we use the two? At the Apollo hospitals where I work, we have been trying in our own small way for digital empowerment. But unfortunately, we are just an oasis in a desert, and I personally am very frustrated that we suffer from a condition called pilotitis. We have done dozens and dozens of pilots, proof of concept validation, but still we are unable to escalate this into the healthcare delivery system. I believe that you are the cream of the cream of the cream of India, and if you cannot help, no one else can help. So I'm going to appeal to you with solid data to show that you and you alone can make a difference. Now, these are some of the products which we do. For lack of time, I'm not going into all these details, but just to prove the point that today a patient need not be physically in front of a doctor. Ladies and gentlemen, distance has become meaningless. As one management guru said, geography has become history. If I were the health minister of India, I would probably say that from 2030, India need not build a single hospital. Patients should not go to hospitals. Hospitals should go to patients. You can have a doctor in your pocket. You can have a laboratory in your pocket. Your smartphone can be converted into 85% of what a hospital does. I jokingly told Dr. Pratap Reddy 18 years ago when I got interested in telemedicine, I told him, sir, if I really succeed, you'll have to close down Apollo hospitals, All India Institute of Medical Science and whatnot. Today, excepting for bone marrow transplant, cardiac transplants, head injuries, liver transplant and things like that, you do not require a hospital. Unfortunately, patient participation is the least so far as healthcare is concerned. We do not shout when we have to print our own airline tickets. It's 3 years since I went to a bank physically. But how many of us, as one of the previous speakers mentioned, really take a proactive part in our own healthcare? I hope technology will not let me down. You can see here, this was in 2001 that I started doing echocardiograms. Yeah? We don't have a pediatric cardiologist from Madras. Unfortunately, a super pilot project we published, we presented, but that was the end arbitrary. We were not able to integrate this into the healthcare delivery system. Now this is where we require help. Now here, a simple iPad or a tablet. Today you can get a good tablet for 5,000, 6,000, 7,000 rupees. With a tablet like this, I can do a detailed neuro-ophthalmic evaluation. I can even check color vision and so on. I have personally done about 1,900 consultations in neurosurgery over the last couple of years. Now here is a typical example. This patient is in Dubai. Now, believe me, a CT scan will not give you the diagnosis, an MRI, an EEG, the most sophisticated investigation in the world will not give you a diagnosis. All that is required is seeing the patient like this. I will not find any neurological deficit. But in practice, a good MBBS student should be able to make this as a textbook diagnosis of what's called temporal lobe seizure. The diagnosis is extremely simple. But then, when the patient comes to me, it's unlikely that he will have this convulsion, this episode in front of me. What did I do? An ordinary lower income family, a Tamilian family in Dubai, I told the lady, look, you have a mobile phone. Next time your child has these attacks, take a photograph and then send it to me. And this was all that I wanted. I put her on the appropriate medicine and the child is totally normal. 3 minutes of my time for a trained observer. That's all that is required. Now, we have part of our activities include corporate social responsibility. We have a multinational company which has given us a major 4 crore project. We have today, using technology, we have been able to screen 350,000 people for lifestyle diseases. We also have health education modules. I wish I had 2 hours to talk to you, but I see Madam already looking at me saying you've got 6 minutes more, so I'll try to wind up. Now, I strongly believe that health literacy is the most important thing. Again, if I were the health secretary, I would allot 20% to the health budget to promoting health literacy. Patient empowerment, knowledge empowerment. It is sad today in 2017 July at the Apollo Hospitals Chennai. I am giving Apollo as an example. Take any hospital. I have at least 1 patient today with a devastating stroke who is either a professor, a doctor, an engineer, a chartered accountant, a judge, and so on and so forth. For the simple reason that the so-called elite of the city do not know that they are hypertensives. If they do know they are hypertensives, they don't bother to have themselves controlled. 80% of conditions today could have been prevented. I told Dr. Reddy that, sir, you said 110,000 open heart surgeries we have done, the world's highest. 98% of these open heart surgeries need not have been done in the first place at all. Why do we do open heart surgery? Why does a coronary artery get blocked? Simply because of deposition of triglycerides, cholesterol, sugar, and so on and so forth. Of course, there are genetic studies, etc. But this is an eminently reversible, preventable thing. So what did I do? 2 years ago, I approached Dr. M.S. Swaminathan, and with the help of the M.S. Swaminathan Research Foundation, twice a month my doctors give talks. We have given about 97 lectures so far. About 25,000 villagers have listened to these talks. Unfortunately, I am a scientist. But unfortunately, I don't have funds, I don't have people to help me, I need some help. If only I had help, I could have got solid, statistically valid, scientific data which have proved beyond doubt that this health education did make a significant difference in healthcare parameters. Unfortunately, for all this, we require funding. Just 1 or 2 examples. Now here you can see the government of Andhra Pradesh has entrusted us as a part of a public-private partnership 164 primary health centers. We have totally taken over the management of 164 primary health centers. I have an MBBS doctor, 5 other employees there. Unfortunately, I was hoping that IIT would give it to me, but I don't have connection to the internet. If I had a connection to the internet, right now all I need to do is to click on this dashboard, and you would have seen in real time, you would have seen patients coming to these 164 primary health centers and my data getting updated. This is totally transparent. The Chief Minister's office, the Health Minister's office, the Health Secretary and all authorized officers have access to this. I have access to this with my phone. So every day we have 40 to 45 patients in each of these primary health centers. A total of 7,000 a day. We have already covered about 300,000. About 11.2% of this number have also benefited with specialist consultation, orthopedic, general surgery. I myself have given a few neurology, teleconsults, etc. from the primary health center on a big TV screen. I guarantee these people that within 20 minutes, if it is an emergency, one of my consultants will appear on a screen. We have scheduled virtual OPs. We have done 30,000 of this. Several papers have been published, presented, etc., etc. Now, this is the Himalayas. 14,000 feet height in the Himalayas. The district of Lahore and Spiti, 34,000 population. The government of Himachal Pradesh entrusted this 2.5 years ago. Not a single doctor was willing to stay at temperatures of minus 25 degrees. 6 months in a year, there are landslides, snowstorms, nobody is there. The valley is literally shut off. So my team went there, and this is what we have done. I'll show you one or two examples. You can see here, on a Saturday evening at 5 o'clock, a man comes with chest pain. An ECG is taken at a height of 14,000 feet, transmitted to my emergency department. My doctor says ECG normal, but he looks at his face. He says, I don't like the look of this guy. He just doesn't look well. Tells the nurse, hold on, don't send it back. Keep him there for an hour and a half more. Repeat the ECG. We repeat the ECG and we show that the previous ECG was normal, but in the last 75 minutes he has developed an ST segment wave elevation and so on. A myocardial infarction is picked up in real time, and because we were doing that, we initiated thrombolysis. 7 patients were picked up a myocardial infarction as they were evolving in the Himalayas. This is a power of digital medicine. Another example, a patient with supraventricular tachycardia. This is just to confuse you a little. The pulse rate was 250 per minute. Now, we needed a defibrillator. We had trained people, we had put a defibrillator there. But as happened by Murphy's Law, that particular nurse was trained, was on leave that particular day. And so what did we do? We didn't give it up. We told the nurse, look, we will handhold you. All I want is a webcam and an internet, both of which we have. And my doctor here took the mannequin, you can see here, and with the mannequin, he demonstrated what exactly you do. What is the amperage, what is the joule, how many joules you put, what is that, what is this, everything. And the lady at the other end confidently did this, and we saved the patient's life. We have done this on 4 episodes. You have to take my word for it. Sorry, I've been having problems right since morning.
Fish water.
Now let me come down, let me finalize, because I am also a stickler for time. I don't want to exceed my time. Yeah, okay. Now, we have done enough pilots, we have done enough proof of concept validation. I have personally supervised almost 100,000 super specialty teleconsults in the last 17 years. We have given almost 300,000 primary consults in the last 10 to 12 years. But I am frustrated. I am absolutely frustrated. Why? Because we have centers of excellence, we have proved it's great to give lectures, it's great to present papers, etc. But I have just not been able to integrate it into the healthcare delivery system. I have not been able to scale it. Now here is an example. Now having said that, in all fairness, in the last 2 years the country has made a tremendous progress. Both the central government, the state governments, everything. Public-private partnership is not a word, it's really happening, and I can vouch for it because I am a part of it. Having said that, these are all the states which have opened tenders for various projects. Unfortunately, we are lost in bureaucracy. These tenders have been written by people, with all respects to them, who have no idea of either information communication technology or healthcare, let alone a combination of ICT and healthcare. Half these tenders had to be withdrawn because they were just not implementable. The others were awarded to people who were unable to deliver the goods, and today only 2-3 of all these tenders are actually functioning practically. So, this is something which requires enormous expertise, and unfortunately it is being public money. Naturally there are constraints. Now again, I believe that the success or failure, and I am more interested in the failure. I don't want to talk about my success.
I want to talk about my failures. Where are all the things I failed? Why did I fail? What did I fail for? How do I prevent this? And I want to share with you the reason why we have failed. I think that's much more important. I strongly believe that what is required are human resources. We require trained people. Technology will eventually come. Funding also will perhaps eventually come. But what is required are a few mad people. You require a few mad people, passionate people who believe in this to the extent that they will not take no for an answer. Nobody taught me telemedicine. I got into telemedicine 17 years ago. But today the stage has come where we need to formalize this, we need to start courses, and again with the help of the National Skill Development Council of India, approved with the Health Sector Council of India, we have designed a course, we have started everything. Actually I started a course at Anna University in 2003. But now retrospectively we were just too far ahead of the time. We had 6 batches, but I could give jobs only for 4 people, and so we had to stop the course, even though Anna University was so broad-minded, forward-thinking, that they were ready to do this course. So now we are ready to do this course, but we need help. We need help from people like you. The last 2 slides, I was told at the end of the day, you are going to develop a paper and you want some suggestions. Why should I tell you this is what we did, this is some of these slides, so that they can see it better. So this is what I would suggest. What can the Pan-IIT alumni do? A wish list from the frustrated. I first put the word frustrated, then I thought it was too strong, so I made it more diplomatic and put concerned digital health evangelists. Understand and accept that a Pan-India consortium. Please remember that the government by itself will never ever be able to provide health care in 38,000 primary health care centers. It's just not going to happen. I'm not for a moment saying you're entrusted to me, entrusted to the hospital which I work for. No, not at all. India is a huge country. So you need a pan-India consortium of people, the government, private sector companies, IITs, the educational institutions. It shouldn't be too difficult to form an organization like that and work out, get some fund, 500 crores, 1,000 crores, get some money, get invested, etc. Make a public sector undertaking. Today, the National Thermal Power Corporation, this morning I read that IOC has been ranked as the 193rd company in the world, the only Indian company which is in Fortune 200. If a Government of India company can enter Fortune 200, I see no reason why a telemedicine consortium cannot do equally well. Again, revenue generation is the only way to make something self-sustained. All of you know about Wi-Fi and WiMAX. I use a term which I think I coined called YFM. And I honestly think that is what needs to be attended to. I am not a hypocrite, I am not a diplomat, I call a spade a spade. If you want digital empowerment, what is it you call? Digital empowerment of society. Ladies and gentlemen, if you want this to really happen, please pay attention to WIIFM. That and that alone will really result in this. And what is YFM? What is in it for me? This is the basic question. What is in it for me? Every part, every stakeholder in the ecosystem should have something in it for me. And what the best thing, ever since the physicians discovered money, it is vitamin M, which is the biggest inducement. The only difference between Mukesh Ambani and me is that from my bank account and his bank account, he's got 12 zeros more than I have. That is what makes the difference. So ladies and gentlemen, what is in it for me? So unless this is addressed to, please don't think that healthcare is something, all of us, everybody, especially the younger doctors today, didn't get into the medical profession to save lives. I mean, it's so appealing, wonderful, sacrifice that, this nonsense. See, when I see an MBA from IIM, IIT, make a salary 5 times of what I make. I'm also a human being. I also need to be compensated. So please, somewhere in this, it can be done, it has to be done. And the proof of this is the United States. Last year, 2 years ago, the United States recognized teleconsultations for reimbursement. United Health Insurance, Medicare, Medicaid, the 4 biggest insurance companies. Today, the graph has gone like that. There has been a 5,000% increase in the use of telemedicine in the United States once doctors started getting reimbursed. 56% of Kaiser Permanente, the world's biggest healthcare provider, today are virtual visits. Kaiser Permanente does not encourage patients to physically come there. So this is what is done, adequate revenue generation, centers of excellence delivering telehealth in isolated small pockets, and I would like to consider myself as a center of excellence, but there is no point in our doing this in Himachal, Andhra, there, here, etc. So this is what is required. Make the government understand and accept that virtual, remote, digital health is the only answer. We cannot. Right now the government is making 5 new medical colleges every month. 5 new medical colleges every month. But this will have its downside. Where are you going to get teachers? Where are you going to get clinical material? Where are you going to get... And I am dreading the day 10 years from now when medical doctors pass out of these new medical colleges on that quality. So what is required is, at the same time, many of us are underemployed. We are not Mahatma Gandhi willing to go and work in the villages. I want my creature comforts. I want an air conditioned car. I want an air conditioned house. But every one of us are more than happy to spend 1 hour a week, 2 hours a week doing free health, providing free health care to the towns of India, to the villages of India from the comfort of my house, which is possible to do. All we require is people like you to bridge the gap, to enable it and to see that this is done. Before I'm thrown out, I think this is the last slide. Okay. This is my last slide. As all of you would have guessed, the first 2 pictures are children preparing for the IIT entrance exam. The bottom 2 pictures are their grandfathers learning to teach their grandchildren how to prepare for the IIT entrance exam. This, ladies and gentlemen, is the real India. In the last couple of years, I have traveled fairly extensively and enjoyed it. I've gone to many countries in many states in the Northeast. I've gone to towns, I've gone to villages, and I've been absolutely stunned by the digital literacy which I find in the villages. They know far more how to use a smartphone than I will ever know the rest of my life. So this is the true India. If you think that India is not digitally literate, no. I'm sure you know that the UN recognized, the UN incidentally made a right to internet. The UN passed a resolution 10 years ago making right to internet a fundamental human right. The government of Kerala in its assembly, the assembly passed that in Kerala, right to internet is a fundamental right as enacted by the Kerala state government. 2 districts in Kerala have 100% computer literacy. I don't think anywhere in the world they have 100% computer literacy. So this is the India, and I personally think it will be a shame if we don't exploit, if we don't use information and communication technology for healthcare. Thank you, ladies and gentlemen.
And enriching talk that you had given. May I now call upon our Secretary of IIT MA, Mr. Dalton Eddy, to present the memento to him, please.